औज़ु बिल्लाहि मिनश शैतानिर रजीम बिस्मिल्लाहिर रहमानिर रहीम अर्रहमान अल्लमल कुरान खलक़ल इंसान अल्लमल बयान। आज मैं काफ़ी अरसे के बाद आपसे बात कर रहा हूँ और आई एम सॉरी कि इतना अरसा बिज़ी रहा, कोई नया टॉपिक कोई नई बात लेके नहीं आ सका। तो इंशाल्लाह शुरू करते हैं एक्यूट हेपेटाइटिस के ऊपर थोड़ी सी बातचीत। Acute hepatitis is an inflammatory condition of the liver parenchyma. Remember, it's a condition of the liver parenchyma that occurs abruptly and typically lasts less than 6 months. It can range from asymptomatic subclinical infection to life-threatening acute liver failure. So we can define it as acute inflammation of the liver characterized by hepatocytes injury and necrosis. Biochemically, it is defined by a significant rise in serum aminotransferases, that is ALT and AST, often exceeding 10 times the upper limit of normal. So it can be caused by various things, the most common being the viral infections, and in that hepatitis A, B, C, D, E. Other viruses that can cause acute hepatitis are EBV, CMV, and herpes simplex virus. It can also be caused by the drugs and toxins such as acetaminophen, paracetamol overdose, idiosyncratic drug reactions, for example, with isoniazid and alcohol. It can be caused by autoimmune hepatitis, metabolic or vascular such as Wilson disease, Budd-Chiari syndrome, or ischemic shock liver. So the signs and symptoms of the acute, it can affect the eyes, urine, headache. So initially the patient presents with a malaise. The prodromal phase, the patient presents with malaise, fatigue, low-grade fever, nausea, vomiting, and loss of appetite, anorexia. Then there's an icteric phase in which there's a dark-colored urine, often which is the first sign that is noticed by the patient, pale stools, and jaundice, which is yellowish discoloration of skin and sclera. Physical symptoms, there are the right upper quadrant pain, abdominal pain, or discomfort. The vitals, the temperature, there can be patient can have the low grade fever, which is common in a viral etiologies. Heart rate, the patient can have tachycardia if the patient is dehydrated or septic. Blood pressure usually normal, but hypotension may indicate severe dehydration or progressing fulminant hepatic failure. Other findings are icteris, which is a visible jaundice in the sclera or under the tongue. Hepatomegaly, the liver is soft with a tender liver edge on palpation. Splenomegaly may be present in some viral cases such as EBV. Signs of liver failure, you must check it because they are flapping tremors, astraxis, altered mental status, encephalopathy, or easy bruising, coagulopathy. The other differentials that can be considered are biliary obstruction, cholecystitis, or choledocholitis, usually presents with higher alkaline phosphatase. Acute cholangitis presents with Charcot striate, fever, jaundice, and right upper quadrant pain. Congestive heart failure leading to hepatic congestion. Sepsis, systemic infection causes secondary liver dysfunction. So investigations that are the diagnostic initially LFTs, which shows elevated AST, ALT, often greater than 1000, elevated bilirubin. Serology, IgM anti-IAV, hepatitis B surface antigen, IgM anti-HBC, anti-HCV, and IgM anti-HEV. Imaging, ultrasound of the right upper quadrant pain to rule out biliary obstruction. Gold standard, liver biopsy. While rarely required for acute diagnosis, it is a gold standard for assessing the degree of inflammation and necrosis. But most of the time it is not required and it's not done in the clinical practice. So the treatment is supportive treatment, which includes maintaining the hydration and nutrition and avoidance of hepatotoxic substances such as NSAIDs. For hepatitis B, there are specific treatments such as tenofovir or entecavir if severe or fulminant. Hepatitis C is direct-acting antivirals. Drugs and toxins such as acetaminophen is treated with N-acetylcysteine, and autoimmune is treated with corticosteroids or prednisolone. Now the few MCQs. A 14-year-old male presents with a 4-day history of nausea, dark-colored urine, and jaundice. He recently returned from a backpacking trip where he consumed local street food. On examination, he has tender hepatomegaly. Lab shows ALT 2400, AST 2100. What is the most likely diagnostic finding to confirm the acute etiology? A. Hepatitis B surface antigen, B. anti-HCV IgG, CIgM and THAV, ceruloplasmin level, smooth muscle antibody. The answer is the history of travel and street food suggests fecal oral contamination, hepatitis A or IgE. So IgM and TAV confirms acute hepatitis A. So number 2, a 5-year-old female with a history of pica is brought to ER with confusion and vomiting. Her PTINR is 2.5 and her ALT is 5500. Physical exam shows no jaundice but significant asterixis is present. Which of the following is most appropriate immediate specific intervention? Immediate cholecystectomy, administration of N-acetylcysteine, high dose interferon therapy, ribavirin monotherapy, plasma exchange. So what will you choose? The answer is massive ALT elevation and signs of encephalopathy in a patient with potential acetaminophen pill suggests acetaminophen toxicity. N-acetyl is the specific antidote. MCQ3 is 30-year-old healthcare worker suffers a needle stick injury from a patient known to have chronic hepatitis B. The worker has never been vaccinated. What is the most appropriate immediate management to prevent acute infection? Starts a 6-month course of tenofovir, administer hepatitis B vaccine only, administer hepatitis B immunoglobulin only, administer both hepatitis B immunoglobulin and hepatitis B, observation and repeat LFTs in 3 months. So what will you choose? The correct answer, post-exposure prophylaxis for an unvaccinated individual requires both passive hepatitis B immunoglobulin and active vaccine immunization to provide immediate and long-term. So this is also given to the child who is born with a mother who is positive hepatitis B surface antigen. Thank you for your patience listening. Please comment if anything need clarification. For feedback, send message on this number. I pray that may Allah be our helper, protector and guide. Best wishes. Allah Hafiz.